Hi my beauties, welcome back to Younger. Today I'm going to be talking about winter skincare tips. So before I move on, I ask that you like, comment, and subscribe and share this video with anyone who may find it useful. So the reason why I wanted to talk about winter skincare tips is because as the seasons change and the climate changes, our skin changes. So we sometimes have to adopt new skincare regimen changes and differences in the way we clean our skin, we hydrate our skin, and we protect our skin due to the winter months and things that are involved in the winter season, like skiing, snowboarding, being in the snow, high altitude, climate changes, heaters, fireplaces, clothing that may be irritating like wool sweaters and scarves and things like that. So I kind of just want to do an overview of different skincare tips that I've learned along the way and that can probably keep you out of trouble while we enter the dry and cold winter months. So first and foremost, I want to talk about humectants. So humectants are really important because they minimize the transepidermal water loss for the skin. So basically they keep the hydration in the skin. And some of my favorite humectants are hyaluronic acid, and also our AHAs and our BHAs. So things like colloidal oatmeal and natural humectants are also important too, but some of the more powerful ones are like hyaluronic acid because it can bind itself. One molecule of hyaluronic acid binds over 1,000 times itself in water. So that's going to help minimize water evaporating out of the skin when you're in a very cold climate or when you walk into the cabin after skiing and you have a heater going and a fireplace going that's depleting all the water out of the air. It's going to protect your skin and keep it hydrated. So the use of humectants is really important also because things like our alpha hydroxy acids, which are glycolic acids, lactic acids, citric acids, they also make the cell cohesion less sticky. So it actually increases cellular renewal at the same time as it binds water and allows your skin to absorb more water. So it's kind of like a 2-in-1 in one molecule. So I really am a big proponent of humectants year round, but especially during the winter. And what I also recommend is to put your humectants on, whether they're ceramides, hyaluronic acid, colloidal oatmeal. Aveeno has a great colloidal oatmeal cream that I really like. HA5 by Skin Medica is a more medical grade, and Elastin Skin Nectar is another humectant. There's lots of humectants out there, and I don't want to preach or tell you which ones that I recommend. I can if you want, but I think that, you know, everyone kind of has their own choice of humectants based on their price point and what they're kind of looking for. But the most important thing is to apply it immediately after you are done showering or bathing in the afternoon or morning, whenever you do that, and then to reapply it midday and then again at bedtime. So it's important during the winter months for sure. It's a pain, but if you can do it 3 times a day, it's really, really important. And moms with babies and kids, it's really important to do this for your kids as well, because kids are more predisposed to eczematous dermatitis or dry, itchy, red skin. The filaggrin protein, not to get too nerdy on you, in the dermal epidermal junction in kids is kind of a little bit underdeveloped, and so the kids are more responsive to drier, colder climates as well. So it's important to keep your kiddo's skin hydrated as well. So humectants are a must. They're really, really important, and don't underestimate the power of humectants. Of course, trying to be fragrance free if you can. Now, a lot of medical grade has fragrance, and I know that I've had a lot of questions and comments on this, but to each his own. And if you can avoid fragrance, that's better, but fragrance are sometimes hard to avoid, especially the term fragrance free is even a fragrance. So just be careful when you're reading the active ingredients to make sure that you're avoiding things that can irritate your skin and make you red, dry, peely, itchy, and things like that. Also, the use of diffusers and humidifiers is a huge must. So things like fireplaces and space heaters and heaters, they deplete the air from moisture, and so it can make your skin even more dry and irritated. So having humidifiers and diffusers going even all day when you're in drier climates is really important. I'm a Southern California girl, but I had to do a combined procedural fellowship in Northern California. Was a really dry climate, and I was like dying because my skin felt so dry and so cracked. And I remember seeing my patients like take a huge age jump in the way that their skin looked, because as we entered the winter months, their skin would look older and depleted of hydration and moisture, and so it looked more wrinkly and people would look more aged. And so when I would go home, I remember we ordered off of Amazon a monitor that monitored the moisturization or the water content in the air. And I remember in Southern California, it was usually 60 to 80%. But when we went there and we had the heaters and fireplaces going all the time, it dropped down to like 10 to 15%. And my skin would get cracked and itchy. And I remember I was a Mohs surgeon, so I was scrubbing my hands every day and my hands would like bleed when I would make fists. It was awful. But once we got diffusers and humidifiers going all day, we kept the percentage above 40, 50%. It had a true effect on my skin, and when I recommended it to patients as well, it seemed to help. So moving on to other areas besides just body skin, especially during the winter, you have to take care of the lips, the hands, and the feet because they can get dry, they can get cracked, and they can get fissured. And once that happens, it's a nidus for infection, and it can cause and exacerbate an eczematous dermatitis because you're allowing irritants and allergens into the skin past the barrier, and that can ignite a really positive, a bad reaction that's going to just propagate itself. So it's really important to maintain that barrier. And so I just recommend just doing something as simple as Aquaphor or petroleum on your lips. Try to keep it, throughout the day when you wake up in the morning, sometimes midday, and definitely when you go to sleep at night, because you're hopefully going to be having 6 to 8 hours of uninhibited interaction, eating or talking or drinking, to where you could just lay in bed at night and have your petroleum kind of maintaining that lipid barrier in that minimizing transepidermal water loss on your lips. Another thing that happens to people is they get something called cheilitis on the corners of their mouth. So this is actually caused by a yeast that happens because of moisture in the corners of our mouth. So a lot of people, when they sleep, if there's a little bit of drool or saliva in the corners of your mouth, will allow the yeast form, which is a ubiquitous yeast that's kind of everywhere, but it thrives in moist environments. So basically, by putting a little antifungal in that area, just over the counter, like even if you go to CVS or Rite Aid or Walgreens and you get even a Lotrimin that you would use for like athlete's foot or jock itch, you just put that in the corners of your mouth. Sounds gross, but that will knock it out right away. Or by providing a barrier before that happens in the corners of your mouth by some Aquaphor, Vaseline, or petroleum. Or if you want to get fancy and use medical grade like HA5 by Skin Medica or something along that nature, as long as you're providing a barrier to protect that in the corners of your mouth, you'll be good. But an antifungal will help too once it kind of gets a little bit more red and out of control. Hands and feet. So one of the most interesting things I remember learning in dermatology residency, and we learned this with our eczematous babies and our kids with eczema, is right after you wash your hands before you go to bed, if you want to put Aquaphor or Vaseline on your hands and then wrap them in saran wrap or put Ziploc bags over them and then put socks over your hands and feet. If you sleep with it like that, it's a little bit slimy and uncomfortable, but when you wake up, your hands and feet will be crack-free, they won't be dried, and they'll just feel amazing. So it's almost like getting like a paraffin wax every time you go to bed. That's like one of my most fun tips to give to people, especially like it's not very expensive and it's something that you can do, and it actually makes a really big difference. Also, around the eye cream is really, really important because the skin gets so dry that delicate eye skin around the eye is the first to get hit with that dryness, and you start to see like the fine lines and wrinkles get a little bit more exaggerated in those areas. So using a really hydrating eye cream I like is Clinical Youth Eye Serum. I love Elastin's Trihex technology for their eye cream. If you have drugstore limitations, you want to just shop drugstore, just a hyaluronic acid humectant eye cream is really, really good, or one with retinol like Rock. So I try to recommend medical grade and drugstore, but as long as you're TLC to your periorbital area, especially under the eyes during the winter months, that's really important as well. Maintaining hydration. You guys, I always say drink 2 liters of water a day. The biggest problem with human beings is that we don't start drinking until we're thirsty, and by the time we're thirsty, it's too late. Your ADH levels are skyrocketing, and unlike other species like dogs, they just drink before they're thirsty. They stay better hydrated than we do. So have a hydro flask or something, especially if you're skiing, snowboarding, or in the winter months, and make sure to just maintain at least 2 liters of water a day. So that will help have hydration in your skin as well. So other things that you can do to protect your skin is when you are at altitude and when you are skiing or snowboarding or just playing in the mountains, make sure that you wear sunscreen. Sunscreen is not just for summertime when you're out on the beach or the lake with the sun. When you're at altitude, the sun, the UV light, the UVA1, UVA2, UVB rays are way more powerful than when you're at sea level or below. And also the snow is just going to reflect all that right back up on your face. So make sure that you get it on your neck, on your face, and when you're skiing, just make sure that you're wearing your sunscreen even in the winter times, even when it's cloudy and gray and there's windburn. You want to make sure that you're wearing sunscreen. Other things to note that are totally random, but I get DMs on, and I always make sure that when I do go skiing or snowboarding, or I'm out in the elements, that I don't wear goggles that are too heavy and pressing down on the cheek area. So I have actually a ski helmet that has drop down goggles, so they actually aren't even touching my skin, because like sunglasses, all that weight can cause some volume loss in the mid face, which can age us too. That's totally being extra, but I know that you guys who follow me are into that kind of stuff. So if you can avoid heavy goggles when you're skiing, or especially if you're like wearing them that strap on your helmet or like pushing down, if you take your goggles off and you have marks on your face, time to get a new pair of goggles. So I hope I'm not forgetting anything else, but I wanted to check my notes really quick. Oh, also, when you do take showers, so all the fun stuff is bad for your skin. Fireplaces, heaters, really hot showers, jacuzzis. I'm not saying you can't live your life and go in a hot tub. That's totally fine. But just make sure when you get out, you hydrate like crazy. Like even when you're still wet, before you dry off completely, have your big tub of Cetaphil or amlactin or whatever you want next to your bag, and just make sure that you lather up after getting out of the hot tub, because that is just going to extract all the water out. And by hydrating right afterwards, it's going to seal in the moisture so it doesn't evaporate with transepidermal water loss as you walk into the heated cabin or heated room or heated house. So the other thing to avoid, unfortunately, are really hot showers. And I love hot showers, and I have to even myself take it down a notch. Now, dermatologists recommend to take 5 to 10 minute lukewarm showers. So not longer than 5 to 10 minutes, which I can't even follow that. But if you can, that's great, but not too hot. If you don't have to be lukewarm, because that's a little bit too hardcore. But if you have an ailment like eczema or psoriasis or atopic dermatitis, you probably have to take lukewarm showers. But the less hot and the less time you spend in the shower, the more water loss you will have that gets leached out of the skin. So I think that's it. I want to make sure I didn't miss anything, which I don't think I did. Oh, last thing. Avoiding irritating clothing like wool and scratchy scarves and sweaters. That can elicit a kind of a positive reaction where you get itchy, and then you scratch your skin, and then it recruits your inflammatory cells, and you get inflammation, and then it gets red, and then it releases histamine, you get more itchy and red. If you could just avoid that kind of clothing, or have some type of silk sheet on first, or like some scarf that can kind of protect you if you want to look cute with your big wool scarf, wear like a high turtleneck that's going to protect you from getting irritation from itchy clothing during the winter months. So that's another thing that comes up a lot. And I know I said last thing, but I lied. This is the last thing. Maintaining your omega-3 fatty acids. Fish oil is huge. All the natural fats and oils, avocado, nuts, almonds, all your omega-3 fatty acids is going to maintain a better lipid cell membrane and a better lipid barrier. That's also the barrier to prevent transepidermal water loss. So just making sure that you have healthy fats and oils is also great, and will keep your skin hydrated during the winter months. I hope this helps you guys. Thanks.